Krista and welcome to the American Posture Institute. I'm standing in here in our room where we do postural correction. I literally just got done working with patients this morning. What I wanted to do is explain today what separates the API system, what makes it so great, and why can we guarantee results for our patients. Well, it starts with a three-component system: spinal alignment, postural rehabilitation, and posture habit re-education. Any of these by themselves is not going to be adequate to guarantee long-term postural correction results. That's why we utilize all three components. So the first is spinal alignment. When we focus on spinal alignment, we focus on spinal alignment from two perspectives, globally and locally. Globally, looking at the overall curves of the spine and how those are lined up posturally. And then we look more locally to identify the exact cause, the primary postural distortion that's causing inadequate postural distribution of the body throughout the rest of the body, because the rest are going to be compensation patterns for that localized primary postural distortion. So we do spinal realignment techniques to realign the spine. And then we focus on postural rehabilitation, because once the spine is in proper alignment, we need to then strengthen the muscles to help support the new position of the spinal column and the rest of the body, also the hips included. When you strengthen those muscles, you can naturally hold a good posture without feeling like you have to fidget or really try and hold yourself up. In addition to that, we're going to find what muscles need to be lengthened, because some muscles are going to be chronically contracted from having been in the wrong position, overly utilized due to improper posture for some patients up to a lot of years. So we're going to find where we need to strengthen and lengthen the musculature with the postural rehabilitation. And the final component, perhaps even the most important component, is posture habit re-education. Now this part is lacking in a lot of other systems. What we do is educate our patients of how to live a healthy lifestyle while having proper posture and doing their normal daily activity. Because if you leave the office after getting a great postural correction treatment and continue with your old habits, just like a diet, you're not going to be able to maintain the same form that you would have. So for example, if you go and work out really hard at the gym, but then you leave the gym and eat a bunch of junk food, you can't expect that you're going to have the same benefit that you would if you followed both components. So again, focusing on spinal realignment, postural rehabilitation, as well as having proper posture habits. Okay, that's the API system. Thanks for joining me in my clinic today. My name is Dr. Krista, and I want you to remember, it's posture by design, not by circumstance.